Hey everyone, Bridget here at the AAFE Training Center. We are treating some neurotoxin on my patient. So we are going to be treating basically full face tox. She gets this every 3 months. So she's pretty regular. She keeps up with it, as you can tell with her very glowy forehead. She's been getting this for years and years and basically doesn't really have any movement or wrinkles there. So we're just kind of maintaining, so her dose kind of gets altered every time she comes in, just depending on what type of movement and if she's waited a little bit longer than 3 months. So I'm going to make sure I'm treating all the way out to my lateral borders. You can see that she has a little bit of movement closer to the brow versus in the center of the forehead. So I'm going to focus most of my volume over the brow. I always stay at least a finger breadth above the brow just to ensure that I'm not dropping that center of the brow. Next, we're moving down to glabella, where I'm picking up and isolating each muscle, so the procerus and then the 2 corrugators. I am treating a medial and lateral corrugator on her, so I always make sure to watch my needle depth, make sure I'm no more than half needle depth on the lateral injection site. And then the medial, I can go basically, full needle depth, 3/4 needle depth is pretty safe. It's really when you're working your way out, just because that frontalis sits underneath. So we just want to make sure not to drop that. And then for the crow's feet, so the orbicularis oculi, sphincter muscle around the entire eye. So when you silence it, it helps prevent those crow's feet from forming in the corner of the eye. So you can do anywhere from, 1 injection point to 5, 6 injection points, just depending on the patient. We keep hers pretty basic and just do 3 injection sites. And I always choose the product that either my patient has had a good experience with or that something isn't working for them and we need to switch it up. So you can use any neurotoxin on the market to do any of this. But I usually just choose, the ones that work well with the patient and stick with that, and then switch it up every so often to prevent any sort of resistance. Now I'm treating up into a brow lift, which is just treating further up in the orbicularis oculi. I always use a tight dilution for this just to ensure I don't want a lot of spread. I'm now working my way to the lower face, so we're treating radial lip lines. That is one of her main concerns. So I'm going to make sure to go all the way around the orbicularis oris muscle and treat it equally. It can feel a little bit weird for your patient if they've never had it treated before. It can kind of be difficult to grasp onto a fork and grasp onto a straw and things like that, so that is totally normal. I'm now treating her DIO, which is the muscle that kind of downward turns the mouth over time. We do this every single time on her because at rest she does have a pretty strong DIO muscle. So I'm also treating her mentalis. You can see that she does have a little bit of texture on her chin, so we want to smooth that out. So we also treat this every 3 to 4 months. Now we are treating her masseters. We have been able to wean this dose significantly. So she started pretty heavy, and now we do, a pretty light dose. And I add a bunch of saline to be able to make that spread throughout the entire muscle. We do sometimes treat her deep masseter as well, but this time she was only having pain in her superficial. I hope this helps.